We were really well positioned to help, and this pandemic hit really close to home for me. I have 5 family members, luckily not here in California, but 5 who were affected by COVID. All of them luckily have come through it okay, but we realized that we had developed a very powerful and tiny and easy to use filter that could protect people that also does health sensing, and that we had 15,000 of those in stock, 15,000 of these filters. And so we realized too that like when I go to work now, they measure my temperature, we have to do attestations about our health. This can be done in real time, all the time with such a platform. And so we realized we really had we were in the right place with the right knowledge at the right time to help.
So give us a look at your first product.
And so the device itself consists of a few parts. This is the device, and here's the back. And this has nose buds which come in a variety of sizes so that you can fit this just like you might an Apple AirPod. This is a true AirPod. And then it's got a very sophisticated sensor system that you breathe through built into the bottom. And then if you take it apart, the top comes off, and you can see here we've got the world's smallest disposable filter. And so when you're wearing this system all together, it actually merges with an app. It can tell you the air quality of where you are and the air quality that you breathe, and then give you real-time health metrics, which is very unique. We give an equivalent number of cigarettes avoided smoking over time, for example. This measures real-time respiratory rate, and this would give you a number, and the Sokol breathes with you. We give real-time pollution maps, which actually can be overlaid with health information.
And you have a prototype of your upcoming product that can actually detect mask leaks?
We have a really new product. This is a prototype of it. It's the size of a postage stamp and can be made even smaller, which has all the features and even some more that aren't currently being shown to consumers in our first device, which could take any dumb mask and differentiate that and make it a mask that can measure real respiratory health.
How useful is it to be able to detect leaks?
Right. So I'm a professor and a physician at Stanford University, and when we get fit for a mask, what happens is they give us a certain, not this specific one, but a certain kind of mask. You put it on, and then they put a whole hood over you. They spray a chemical that's like a perfume that leaves a bitter taste in your mouth, and then you have to read a paragraph of a children's book, and if you taste any bitterness and can smell that, then you fail that test. And I can tell you that getting a proper fit is actually quite difficult. It takes time and fitting. They make us shave completely, which many people out in the community don't even know. And you can see even this mask, which is an N95, you can see right over the top of. So if you're trying to wear one of these masks out in the community to protect yourself from things like COVID or the flu or any number of things, and it has any air leak, it's not really protecting you very much. And that's the idea behind using something that actually creates an added layer of protection.